Welcome to the Maternity Mentor. Today we will be talking about antibiotic use during pregnancy, what is safe to take and what is not, and how using an antibiotic may save your life. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Antibiotic use during pregnancy is very common. Let's explore why you may be prescribed an antibiotic, what infections commonly need antibiotic treatment, and the names of safe and unsafe antibiotics for use during pregnancy. An antibiotic is a medication that is used to kill bacteria. Bacteria are microscopic organisms that can cause infections in our bodies. These infections, if left untreated, can cause serious harm. Antibiotics are always prescribed when the risks of not treating the bacterial infection outweigh the risks of using an antibiotic medication. Antibiotics will not treat viruses, and not all antibiotics are the same. Some antibiotics work better at killing certain types of bacteria than others, so choosing the right antibiotic is important. The use of antibiotics during pregnancy is generally safe. During pregnancy, these medications may pass through the placenta to your baby in small amounts. However, bacteria may also do the same. There are many antibiotics that have been used for decades during pregnancy, which has provided a massive amount of information about the safety of antibiotic use. Safety ultimately depends on many factors, including the type of antibiotic being used, when during your pregnancy you take the antibiotics, how much antibiotic you need to take, what the possible side effects are on your pregnancy, and how long will you need to take the antibiotics. Finally, the most important consideration about the safety of antibiotic use during pregnancy is what is the risk of not treating the infection. There are infections that, if left untreated, can cause fetal death or maternal sepsis, which can lead to maternal death. When your healthcare provider is recommending the use of antibiotics, it's because they have determined the risks of not treating your infection are high. Talk with your healthcare provider and have them explain their decision to you so you can feel more comfortable. As with any medication, there can be side effects from taking an antibiotic. These can include nausea and vomiting, stomach pain, gas and bloating, diarrhea, and appetite loss. Additionally, taking an antibiotic may upset the balance of vaginal flora or organisms you normally have in your vagina, causing a yeast infection. For more information on yeast infections during pregnancy, please see our video on this. We will link that in the description below. Antibiotics are also a medication people may be allergic to. Symptoms of an allergic reaction include itchy skin or rash, hives, swelling, feeling sick, wheezing or coughing, tightening in the throat, having trouble breathing, and losing consciousness. If you think you're having an allergic reaction, you need to call your healthcare provider immediately. If you are having trouble breathing or have swelling in the throat, face, or tongue, you need to call 911 or go to the nearest emergency room. Always call your healthcare provider if you have any questions. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about common infections treated by antibiotics. There are many infections your healthcare provider may need to treat using antibiotics. These include listeria, gallbladder infections, sexually transmitted diseases like syphilis, chlamydia, and gonorrhea, appendicitis, bacterial vaginosis, urinary tract infections and kidney infections, placental and amniotic fluid infections, chorioamnionitis, and Group B streptococcus infections. For more information on Group B streptococcus infections during pregnancy, sexually transmitted diseases during pregnancy, or urinary tract infections during pregnancy, please see our videos on these subjects. We will link them in the description below. The antibiotics on this list are reviewed by the Food and Drug Administration, or FDA, for their safety for use during pregnancy. These medications are rated for their safety through a variety of methods, including reviewing data on the risk of fetal birth defects or death. Safe antibiotics include amoxicillin, ampicillin, augmentin, cephalexin, cefaclor, clindamycin, erythromycin, and penicillin. Penicillin is by far the most commonly prescribed antibiotic during pregnancy due to its efficacy as well as safety profile. This is not the entire list of safe antibiotics for use during pregnancy. Your healthcare provider may need to prescribe a different antibiotic that is not on this list. That is because they have determined that medication would be better used to treat your infection. This does not mean that medication will harm your baby. The risks are still very low with most antibiotics, and the risks of not treating the infection to the baby are far greater. The following medications are not recommended for use during pregnancy: Bactrim, ciprofloxacin, doxycycline, furidantin, kanamycin, macrobid, macrodantin, metronidazole, minocycline, Septra, streptomycin, and tetracycline. Two categories of medications that are avoided during pregnancy include fluoroquinolones and aminoglycosides. Now, not all birth defects caused by an antibiotic are life-threatening. Tetracycline, for example, used after 15 weeks of pregnancy, can cause your baby's teeth to be stained. I have personally seen many of these medications used safely during pregnancy, including metronidazole and macrobid. Part of the reasons for that is because of the timing of when they are used during the pregnancy. The later you use an antibiotic in your pregnancy, generally, the safer it is for your baby. Another consideration is how long you're going to take the medication. If it only needs to be taken for 7 days, that is far safer than a medication that needs to be used for 21 days. When your healthcare provider has decided to recommend the use of an antibiotic, it's because the infection is posing a serious risk to the health of you and your baby. Miscarriage, maternal death, and fetal death are all risks of untreated infections. Make sure to talk to your doctor about your concerns and what options for types of antibiotics are available to you. If you're not going to take an antibiotic, you need to tell your healthcare provider so they are aware. They will counsel you on the risks of your decision and tell you what signs to look for in case the infection gets worse. If you are prescribed an antibiotic, it is very important you take it exactly as prescribed. Many times, you will start to feel better before the antibiotic is finished. That just means the antibiotic has killed off some of the bacteria, but it hasn't finished the job. If you stop taking the antibiotic before all the medication is gone, in a couple weeks you will be sicker than before and need an even stronger antibiotic, which may be riskier to your baby. Also, home remedies can relieve symptoms, making you believe you are better when you are not. It's okay to rest, drink fluids, eat healthy foods, but these do not replace an antibiotic. Remember, this video does not contain every antibiotic available, just the most common ones. Always talk to your healthcare provider if you have any medical questions or concerns. Antibiotic use during pregnancy can be scary. I hope this has explained that using antibiotics during your pregnancy is important and showed you that antibiotics are safe for use during your pregnancy. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.